October is Breast Cancer Awareness Month, and tonight we take a look at some of the unique challenges of screening, preventing, and treating this disease during a global pandemic. And for women with what's known as the BRCA gene mutation, the journey can be especially daunting. ABC's Erielle Reshef has this report.
It's a delicate topic for so many.
I have known since I was 14 that this is a mutation that ran in my family.
Seeking preventative care for heightened cancer risk, a deeply emotional experience.
I had my breast surgeon as well as my gynecological oncologist telling me that as soon as I knew we were done trying to have children, I needed to pull the trigger on a bilateral preventative mastectomy and a total hysterectomy.
But during the COVID-19 pandemic, an added layer of anxiety and logistical complexity. New research finding breast cancer screenings like mammograms were down 63% between March and June. And researchers at Quest Diagnostics finding a dramatic decline in new diagnoses for 6 cancers, with a 52% decrease in new breast cancer patients per week. Dr. Judy Garber, chief of the Division for Cancer Genetics and Prevention at Dana-Farber Cancer Institute, says it's an alarming trend.
When COVID is under control, and that day will come, cancer will still be here. And I don't want people to forget and not take care of those risks, especially our high-risk populations, while they're still coping with COVID.
45-year-old Shannon Terrell's mother was diagnosed with ovarian cancer in 2011. In 2014, Shannon tested positive for the BRCA2 gene mutation.
On December 23rd, 2014, as I was packing up my office to leave for the Christmas holiday, I got the dreaded phone call from Heidi telling me that indeed my results had come back and I was positive.
Women with the BRCA1 gene mutation have a 72% chance of developing breast cancer by age 80, and BRCA2 carriers have a 69% chance, which means cancer is likely but not certain, leaving these women with a difficult choice. Shannon, a so-called pre-vivor, opted for a preventative double mastectomy to reduce the chance of her developing cancer. She scheduled the procedure after losing both parents and a close friend to illness in 2019.
Those were 3 things that really culminated in me deciding that 2019 and 2020 had to be the years that I went ahead with my surgeries.
But Shannon's surgery was pushed back twice due to the COVID-19 crisis.
Somewhere around the 3rd week of March, once the hospitals started saying no elective surgeries were going to be held and only the surgeries that were deemed necessary were going to be held in the hospitals. I got a phone call from the doctor's office telling me that our surgery had indeed been deemed elective and therefore was being put on hold.
And Shannon is not alone. 28-year-old Andrea Wallens was also worried her procedure could be postponed due to the pandemic.
Even when I had it scheduled, there was still a lot of uncertainty as to whether there would be another surge in the summer.
32-year-old Caitlin Meyer-Krause had to fight to see a doctor in person for her regular checkup after finding a concerning spot.
It took a little bit of convincing the nurse, and finally I was able to advocate for myself and be seen in person.
Despite the challenges, all 3 have taken care of their health, which Dr. Garber says is critical during these trying times.
What is your message to your patients right now?
For my patients who know they have increased risk and who have been working to control that in their lives by their monitoring, I say, we are all working out ways to monitor you safely. Come and have your screening. For patients who really feel that it's time for them to have preventive surgery, which for some of our patients is the right way to handle their risk, that too is happening.
And some genetic testing can even be done at home through telemedicine.
We do it all virtually, just like we're speaking to each other today. And then they get a kit in the mail and they send a saliva sample. So you can investigate these things from the comfort of your office or bedroom.
And for those pre-vivors, there's added urgency to proactively seek treatment.
The thought of not going and maybe having cancer and it progressing scared me more than spending that time and being seen.
With a global pandemic on top of an already difficult journey, many pre-vivors are finding solace in community.
Now that the pandemic has happened, there's a ton of people in the community, both pre-vivors and breast cancer patients and survivors, thrivers, who are all kind of going through this together.
Organizations like Force bringing together those facing hereditary cancers and providing resources to help them navigate an emotionally taxing and arduous process.
Just knowing that you're not alone and there are thousands of other people out there going through the same things, going through screenings, that are thinking about surgeries and the different opportunities of surgeries, and it's really powerful knowing that you're not in this alone.
But with unprecedented challenges comes unprecedented resilience.
So here we have patients who have an inherited risk of cancer that they've been learning to live with. They have to find a way to incorporate that into their lives. And maybe because of that, when COVID comes, it's one more thing. But it's one more thing. And they have been remarkably still reaching out, taking care of each other, taking care of their families. They now think of COVID as well, but people are amazing, and COVID brings that out in us as well.
Erielle Reshef, ABC News, New York.
A reminder of resilience. Our thanks to Erielle for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.